Remote nursing used to sound like a contradiction. Nursing is hands-on, right? But in 2025, part-time remote nurse jobs are very real, and for a lot of nurses, they're the cleanest way to keep clinical impact without the burnout of non-stop shifts, commuting, and chaos. The trick is knowing what remote nursing actually means. Most part-time remote roles aren't about doing bedside care through a screen. They're about doing the parts of nursing that already happen through communication, documentation, decision-making, education, and coordination, just with secure systems, protocols, and a headset instead of a supply cart. So what are the best part-time remote nurse jobs in 2025? One big category is telehealth and virtual visits. This is the closest thing to traditional nursing that's still remote. You're supporting providers and patients through video or chat, intakes, medication reconciliation, symptom questions, education, follow-ups. If you like structured conversations and clear workflows, telehealth can feel surprisingly satisfying. Then there's nurse triage, especially after hours and weekend hotlines. This is phone-heavy work, usually guided by triage protocols. It's fast. It's intense. But it's also a great fit if you're the kind of nurse who stays calm under pressure and can turn messy symptoms into a clear, here's what to do next. Remote patient monitoring, or RPM, is another strong option. You're watching trends from home, blood pressure, glucose logs, pulse ox readings, and stepping in when something looks off. It's part clinical judgment, part coaching. If you like spotting patterns and helping patients build consistency, RPM can be a great part-time lane. A lot of nurses also move into case management or care coordination roles. These jobs aren't always flashy, but they're impactful. You're helping patients navigate care plans, referrals, follow-ups, barriers, and transitions. You'll document a lot. You'll communicate a lot. But you'll also feel like you're preventing problems instead of constantly reacting to them. On the more behind-the-scenes side, there's utilization review and prior authorizations. These roles focus on medical necessity, documentation, and guidelines. You're reviewing charts and aligning clinical details with criteria. It's perfect for detail-oriented nurses who don't mind deep reading and precise writing. Clinical documentation improvement, CDI, is another underrated remote-friendly path. It's about making documentation clearer and more accurate, often tied to quality and coding workflows. If you've ever been the nurse who catches inconsistencies in charts or thinks, this note could be so much clearer, CDI might fit your brain. And then there are education and quality roles, remote nurse educators, onboarding support, patient education programs, quality improvement work. These tend to feel less urgent than triage, but they still matter. You're helping teams and patients do things correctly, consistently, and safely. Now here's the part people overlook. Remote nursing has rules. Often more rules than bedside. Licensure matters. If you're supporting patients across state lines, employers typically want you licensed where the patient is, or eligible through compact privileges where applicable. In other words, remote doesn't automatically mean work from anywhere with one license. It means work from anywhere while meeting the state requirements of where care is being delivered, and privacy is non-negotiable. A remote nurse needs a real workspace, private, quiet, and compliant. This isn't take calls from the couch while the TV is on. It's secure logins, protected screens, approved tools, and clean documentation. If you want remote work, you have to act like a professional office, inside your home. What about pay and schedules? Part-time remote nursing pay varies a lot based on the role. Some jobs pay similarly to bedside, some pay less because you're trading differentials for flexibility, and some pay more, especially contract-based work like training projects or specialized review roles. The schedule patterns are usually predictable: evening blocks, weekend coverage, PRN shifts, or set daily windows for monitoring and coaching. The next question is, how do you actually get hired for these roles? First, your resume has to look remote ready. Employers want confidence that you can communicate clearly, document well, and handle systems independently. So highlight the remote-friendly parts of your nursing work: triage experience, discharge education, chronic care follow-up, care coordination, documentation quality, protocol use, and workload prioritization. Second, pick one lane and target it. If you apply to telehealth, triage, case management, UR, CDI, education, and quality roles all at once, your resume becomes generic. But if you pick a lane, like triage, and tailor your bullets to triage skills, you'll feel instantly more hireable. Third, watch out for scams. Remote healthcare postings attract scammers because people want them so badly. If someone asks you to pay for equipment, move the conversation to WhatsApp immediately, or offers you a job without verifying your license or doing a real interview, walk away. And finally, use better search tools. Part-time remote nurse jobs are scattered across the internet. The faster you can filter and apply, the more likely you are to land something that fits your life. If you want to browse remote listings quickly, you can use HireBasis to search and apply through the Find Work page. If you're an employer looking for remote talent and want a faster route than traditional agencies, you can use HireBasis to find workers or even run hiring through their RPO service. Part-time remote nursing in 2025 isn't a fantasy. It's a menu. And once you choose the lane that matches your personality, phone-heavy triage, documentation-focused review, coaching-based RPM, or coordination-driven case management, you can build a schedule that supports your life instead of consuming it.